Well, good afternoon and welcome back to both our in-person audience and our virtual audience. Just to recap for the morning briefly before we begin this afternoon's work. This morning we were seeking a kind of overview of the shifts in the business sector that may signal a rethinking of the relationship between business and society, business and health, and between work and health. And what we got was, among other things, a stunning set of facts as context for our day. In particular, highlighting the many ways that wages have stagnated while productivity keeps increasing, how many Americans are working in poverty, and how few Americans actually earn a living wage, and how workers often see work and economic security as central to their health, in contrast with or in striking relationship to those stark facts. What we heard as a way out of that dilemma, that sort of coming dead end, was one, the notion of a new or a renewed social contract that values work and wages and therefore affects health. We also heard about the need to increase the recognition that companies that are just also perform better. But it was also clear that this movement faces considerable headwinds because of different language, different stereotypes, different frameworks used generally in business and in the world of public health. So how do we begin to work our way out of that looming dilemma? In the first session on innovations, we heard two focuses in particular, one having to do with the tradition, not just an innovation, but a longstanding tradition around employee ownership and the attributes that that brings. We also heard about the definition of a good job and the importance of companies that value those different points for creating good jobs that can then lead to better health and well-being. And we also heard an interesting opportunity in the coming massive transfer, generational transfer of wealth that is underway that may create some opportunities for us to make the kinds of social investments and structural investments in wealth and in well-being. This afternoon, we'll continue that path of hearing about innovations and changes in practices that are promising. And in order to continue that exploration, it's my pleasure now to introduce Bob McClellan, who is the Emeritus Professor, Dartmouth Institute, former Chief of the Section of Occupational and Environmental Medicine, and former Medical Director of Dartmouth Hitchcock Live Well, Work Well program. Bob.
Thank you, Ray, and thank you for everyone being here and virtually. I'd like to say a few words to start out before I introduce the panel in just a couple of minutes. So many businesses have developed in-house sophisticated workforce health systems that parallel the purpose and services of community-based public health. Both aim to maintain the health of populations. The services included clinical care, immunization, medical surveillance, and health promotion. And many smaller businesses have contracted with external occupational medicine providers to provide similar services. Both small and large businesses have also designated individuals who serve as health consultants to work with senior management to devise strategies to navigate public health crises, such as the current pandemic. But historically, the community and public health systems, the community and workplace health systems have seldom collaborated. In this session, we're going to explore the catalyzing effect of crisis in helping to stimulate the organizational infrastructure for partnerships between business and public health. In particular, we're going to explore the role of the CMO and the CHO as part of a corporate infrastructure to further health and health equity in partnership with public health leaders to achieve shared goals. We're also going to explore how businesses can leverage and build public trust to support communities in response to crises and improve health through technology, logistics, communication, personnel, and other resources. So unfortunately, one of our speakers has unexpectedly been unable to join us today, Q Ree, who is the Senior Vice President and Aetna Chief Health Officer of CVS Health. But he has been an active part of planning this workshop, and I think I've learned a few things from him that I'd like to just pass on. One of them actually in the one of the pieces of paper posted up there is that every business is a health business. Health is not relegated to health care or public health alone. Every business's success, as we've heard today, is inextricably connected to the health of its workforce and its community. When he talks about community, he likes to quote Quelch, it's in your handout, who states that there are four pillars to building a culture of health for a business: consumers, employers, environment, and community. And he likes to make the point that chief health officers or chief medical officers play a crucial role in a business. And it's important, however, that they not be siloed from the main business operations and strategy. That for it to really have an impact, the CHO, CMO must stand with the other members of the C-suite in making these strategic decisions. He also has a cautionary note. As some of you may remember, CVS Health, actually it became CVS Health in concert with a decision they made to no longer sell tobacco in their stores. It cost billions of dollars of revenue, and they expected other pharmacies to go along with them. They did not. And that created a lonely position from a business perspective and otherwise for CVS Health that I think was a bit of a cautionary tool, warning in terms of how businesses should stand out and the importance of collective action. So with that, let me invite my panel member who's here in person, and Pam Hymel, hi Pam, virtually to join the conversation. Pamela Hymel is the Chief Medical Officer of Walt Disney Parks and Resorts, and she's joining us by Zoom, and you can see her on the screens, great. And next to me is Letitia Zarasa, who is the Health Commissioner of Baltimore City. So with that, Pam, I'd like to go to you first to present your perspective from your seat at Disney.
Great. Thanks, Bob. And I am sorry I'm not able to join you all in person. What I thought I'd do is maybe talk a little bit to begin with about how we approached the pandemic as a lesson learned on how employers can partner with public health, and also really how chief medical officers can be strategic partners to the businesses in which they are aligned. So can you all see my screen at this point?
If we're supposed to be looking at slides, we're not.
Can you see it? No?
No. We're having a,
That is a no. I'll just talk on.
we're having a
Is that what we're saying?
conversation. If you want to wait one, can it be fixed? Oh, yes, she's about to do it.
Ah,
Okay, we got it now.
Okay, great. Thank you. Oh, you're showing them. Okay. I love technology. So I think a couple of points on lessons learned from the pandemic and how we really approached our response, but goes to show how a corporate medical director or CMO can really be a strategic partner to the business. One of the key things that we learned early on was someone had to translate complex scientific information into a business format for our executives. They weren't going to read all the science journals, but they needed the short synopsis and what did it mean for the business and how we should be thinking about a response. And then it became very apparent that multiple decisions needed to be synchronized across an enterprise. And working across various groups within a business sector, the CMO can help coordinate that response. Also, I think one of the opportunities we have is the fact that there are diverse regulations governing many business segments because companies now are multinational, they are in various states, various countries. And how do we begin to interpret those regulations and work with our partners on the ground to help interpret that? We also put together a team of experts to make final recommendations, of health and safety experts to make final recommendations to a group of leaders within the organization. And that center of excellence would be able to make decisions for the company, which goes across all various geographic distinctions. But I think the most important thing we learned is we needed to coordinate with external health organizations. We couldn't operate in a silo in this instance, but working alongside our partners in the government really helped our response. If you want to go to the next one. I think where we learned partners are very important in working across these governmental agencies was our work that we did with the CDC, but also state and local health departments. As a matter of fact, the county health departments, when we look at some of our theme parks, especially Walt Disney World and Disneyland located in California and Florida, they were instrumental in helping us be able to reopen the parks and make sure that our protocols were in alignment with all the health and safety regulations that were in place. They helped influence the protocols that were in each park, although we had a centralized enterprise structure. But I also think we had to respond to the additional nuances of each state. And for instance, the California Department of Health had extra layers of protocols in place as we reopened our theme park in California. One of the other things is we work closely with the CDC. We have a large cruise line business, and they were instrumental in working with us with the conditional sail order and then reopening all of the ships to sailing. So I think having those strategic partnerships and being able to identify who those partners are prior to a crisis is key to success in working together hand in hand across business and local government. And then on the last one, I think the other thing that CMOs and businesses can actually do, if you want to go to the last slide, is really share the knowledge that we gain. And we're not good at that. And so being able to share our expertise and share our learnings so that others can advance is an important element of how business and government and business and health and education can work together. We actually published a series of papers in collaboration with some of our local experts on some of the experiences we had during the pandemic, everything from how we looked at false positive results in PCR rapid tests for our studio and entertainment industry that was testing every single day large numbers of people, so that we gained quite a bit of expertise in this area. We also worked together with the University of Central Florida on a study that looked at some masks that we created. One of the things that we wanted to make sure we did was protect our cast members when they were working in our parks, and being able to do that in an environmentally friendly way. We created our own masks that were washable and reusable, and we participated in some studies to look at their effectiveness, and then also their ability to safely reduce social distancing. We participated with other CMOs on a study on temperature screening, and then again talked about the value of CMOs to a variety of different publications. So I think those are all areas of opportunity to work in collaboration with the CMO, and for industry to share its experience with others outside of our own walls. So with that, Bob, I'll turn this back to you.
Great, thanks, Pam. Before I turn to Letitia, I'm curious, you mentioned about coordinating with various government agencies. What about other business leaders in either the community or nationally or globally? Tell us a little bit about that, and did that change at all during the pandemic? And going forward, do you think it'll influence your relationships with other businesses?
Yeah, I think the pandemic was a great learning ground for everyone. We definitely coordinated it with a lot of other businesses. As a matter of fact, we are members of a very large theme park organization, and Disney readily shared our protocols with all of the other theme parks, both domestically and globally, because we felt we had a really good group of protocols in place that would ensure the safety of our guests and our employees. And working across that group was a great learning for all of us on how to really be able to share. We also shared, again, as we began to reopen the cruise line with several of the large cruise lines. There were regular phone calls through a cruise line organization where everyone was not competing on health and safety protocols, but actually collaborating and sharing on those. And likewise, I find that from a collegial standpoint, the corporate medical directors, CMO forums that I am part of, and many other CMOs are a great testing place for us to talk about our strategies and our protocols and get really good feedback and learn from others. So I think, all in all, being able to work together makes us even stronger.
Great, thanks. I have a lot more questions for you, but first I'm going to turn to Letitia, see what she has to say.
Well, good afternoon, everybody, and thank you all so much for the opportunity to be here. As Bob mentioned, I am currently the health commissioner in Baltimore City, and I've been in that role for almost 4 years, so the pandemic hit on my 1-year anniversary. I am formerly Health Innovation Officer at a company called Fearless Solutions, which is a Baltimore-based digital services firm. I also am married to a small business owner, and so I think I bring both the perspective, certainly, of a public health practitioner and pediatrician, as well as someone who's very closely linked to small business and who has worked in small business. And so for us in the city, when the pandemic hit, we recognized that we would have to partner and collaborate with multiple industries, the business community being one of those. So early on, a lot of what we did was meeting with business owners to go through mitigation measures and protocols. As we were learning, we held webinars to answer questions. We provided general guidance for businesses. We encouraged them to offer their employees sick leave, so again, supporting isolation and quarantine for employees. And then I subsequently started a health and business roundtable in the city, which was a bi-weekly meeting between me and business businesses in the city and stakeholders in the city that supported businesses to really discuss mitigation measures. Baltimore City was a city that kept restrictions in place longer than some of our surrounding jurisdictions, and we got a lot of questions about that. And we knew that we would have to partner very closely with the business community so that they understood this is how we as the local health department are reviewing the data. This is how and why we're making those recommendations. And here is the support to hopefully help you all enforce those recommendations to keep, again, your employees and their staff safe. So we've partnered and we continue to partner certainly with the business community, recognizing that we can't do it alone. And so we really need to be working hand in hand.
Did businesses teach you something?
Yeah, that's a great question. I think, again, luckily I had some perspective having worked in a small business. I think, we both learned from each other. I think for them, it was learning, okay, this is how we're approaching the science. This is how we're thinking about the data. I would say on my perspective, recognizing, what it means for a business, especially a lot of our frontline businesses. So think of like your restaurant owners, small business owners, and many of our local hotels. What does it mean to be down, 20% staff? What are the implications of the travel industry being impacted as it relates to the pandemic, and how do we again try to work hand in hand? We're a city agency, right? So we recognize the importance of people visiting our city, but also want to make sure that we're keeping people safe.
Mm-hmm. So Pam, I know that you at Disney actually, as I mentioned in my introductory remarks, conduct a lot of, I will call them public health services, such as immunizing your employees, et cetera, perhaps even sharing data with public health. Could you talk a little bit about some of the functions that you perform that the public health, your local public health would be glad that you perform, and the extent to which they know that you perform it, not just on a qualitative basis, but on a quantitative basis? And then I'm going to ask you the question as to whether or not any businesses in Baltimore you relied on actually to provide some public health services.
Well, I can talk from two perspectives. One, during the pandemic, it was great working with our local health departments. We did a couple of things. One, we actually gave one of our large parking lots to the local county health department to be a super pod site. And we were the first super pod in California to begin giving out COVID vaccines. So that was a great public-private partnership there. But more importantly, we were able to get the COVID-19 vaccines for our cast members, both in Florida and in California, and begin to actively distribute vaccinations. And at a time when many facilities were inundated and it was difficult to get a vaccine, having additional sets of hands from our health services team was a big help to making sure our cast members and their families got these very vital vaccines. But outside of the times of the pandemic, we work very closely with our public health department on any kind of public health investigation for a cast member that may come down with an illness, and have worked together with them on making sure that hepatitis A vaccines are given. And then, if there is an instance of someone having hepatitis in a food and beverage location, we'll take an active role in making sure that we go in and work with them to make sure our cast members get vaccines and are being investigated for any kind of illnesses. And likewise, on any other kind of public health issues where we can work together, we team up with them to be an extra set of hands that we can report out to them on.
Yes, what I would add is, so similar to, what Pam mentioned, we also formed a public-private partnership early on in the pandemic with Johns Hopkins Health System and the University of Maryland Medical System, as well as Care First, which is the largest insurer in the Mid-Atlantic. And though these are health care-related companies, they're also businesses, right? And so they were also, equally concerned about the safety of their workers, especially thinking early on about how do we spare the healthcare system. And so, again, working very closely with them was critical, I think, to the city's overall response. And so they often, early on were testing their own employees, but we were also able, when tests were very sparse in the beginning, to set up a relationship where we could get police officers tested or those that were frontline city employees tested through those hospital systems. Likewise, Care First helped us set up the first call center we had in the city around COVID and helped us triage those residents that needed to be seen in a healthcare system versus those that could be safely managed at home. In terms of case investigation and contact tracing, especially our healthcare facilities, many of them had done some of that on their own. So we might be the first one to contact that employee, but oftentimes, especially our healthcare systems, they were already beginning the process of case investigation and contact tracing once an employee had notified them that they were ill. Another partnership, and this was not necessarily part of the public-private partnership, but with that health business roundtable that I mentioned, was providing vaccination support to those frontline workers, specifically those supporting the travel industry, those working at hotels and restaurants, early on partnering to provide those groups with vaccinations on site at their hotels or restaurants.
So trust and misinformation has really stuck a dagger in the heart of some of the public health goals during this pandemic. I'm curious about how Disney may have worked with public health around this issue of trust. Clearly, Disney has a different, place in the heart of people of your community as well as the United States in general or the globe than public health agencies who are always there to help, right? So talk a little bit to the issue of trust and misinformation, and I'll ask you first, Pam, and then think about you, Letitia, and how you may have leveraged some trusted businesses in your community.
There are a couple of things that come to mind, Bob, that go along the trust lines. I would say the first is, as we were trying to reopen the state of California, one of the key things that our local public health department and actually state public health department were concerned about is just some of the health and safety protocols being adhered to. Everything from wearing a mask to washing your hands at the time early on when everyone was doing temperature checks, getting your temperature checked. And so they came to us and said, could you help us with a communication campaign? And we actually used our Incredibles IP in order to do a campaign. Together you can make today incredible. And it really featured our incredible characters, talking about hand washing, temperature checks, mask wearing. So that was something that was a great way to leverage getting that message out to the community in a way that might resonate differently than just a public health person talking. Additionally, I think one of the best things that we did for our internal cast member teams was we put together a series of videos called Why Your Actions Matter. And in this way, we used our own internal health and safety experts, two of our doctors, our senior vice president of worldwide safety and health, and one of our safety and health directors to talk about why each of the protocols that were being recommended, whether it was wearing a mask, getting vaccinated, physical distancing were important elements for everyone's health and safety. And I think because individuals within the company were reiterating maybe what they had heard from public health or physicians on TV, but this time they had a trusted expert internally. It really resonated with our cast members, who then came to us and said, well, can we share this with our families? And we even worked now together with the Health Action Alliance to make them publicly available outside of the Disney family, so that there was just another avenue for people to get real facts about health and safety protocols and why everyone's individual actions made a difference in all of our global health.
Yeah, I'll talk about it from the perspective of as a health department operating within city government. And so Baltimore City did not, at the time of the pandemic, have a very robust occupational health program. And so often the health department was looked to as the expert for city employees. So the city started what's called our Restoring Services Oversight Committee. So obviously, you know, when everything hit, everyone who could telework did, but we certainly knew at some point we'd have to bring people back, and we also knew that we needed to protect many of those frontline service workers that were never able to go home. And so we were really key advisors in how the city developed its return to work plan for those employees that had gone home that we needed to begin to bring back. That included certainly educating agency leaders, but also providing vaccination events that were specific to city employees, allowing city employees to get permission leave so that they could take the time off to get vaccinations, and then subsequently helping the city set up its testing program for city employees. So again, we had set up testing sites across the city for the community, but as the vaccination became available and the city began to weigh whether or not to mandate it for city employees, they opted for a weekly testing program or vaccination. So we helped the city establish that weekly testing program for employees. We helped them to develop policies, again, and those safety protocols that allowed city employees to come back safely as we were bringing people back.
Tell us a little bit about frustrations you may have had in working with business and how you maybe overcame some of the pushback you had regarding the restrictions, public health restrictions.
Yeah, I think it was definitely a push and pull. You know, I think understanding that you know, businesses have a bottom line. Again, my husband is a small business owner, so I get certainly the importance of keeping people employed and bringing people into your spaces depending on the type of business that you have. But I think where we found common ground is that businesses wanted to keep their employees safe, generally speaking, right? Businesses wanted it to be a safe environment for the patrons that were coming in. And so trying to work from that common ground to say we all want the same things. Here is how public health is thinking about it. Here's what we're recommending from a safety perspective. How do we better equip you to meet what these regulations are, whatever it is, whether it's capacity, whether it's, you know, masking, how do we support you? And of course, you know, like everywhere, there were a handful of kind of those rogue businesses, and we do enforcement, right? And so we're also responsible as the local health department working with police and other agencies to do enforcement for businesses that were non-compliant. That is certainly not our first choice, right? We think our job is to really help support businesses in compliance, and then as needed to do the enforcement so that businesses could correct whatever was found when we sent our inspectors out.
So this meeting today is founded on the premise, or maybe I should say the hope, that in the midst of crisis, there will be transformative change. So you both mentioned getting together with stakeholders in the community as key to addressing the crisis at hand. Have these structures persisted? Is there still a business roundtable that you meet with on some regularity? And I'm going to ask you the same question, Pam.
Yeah, maybe I'll start. No, the Health Business Roundtable has disbanded, but we do have a local health improvement coalition, which is actually a part of a state mandate. And so that actually includes some of our local businesses and other stakeholders. It includes our partners in the public-private partnership. So that component of it has continued, but I think as a local health department, we had to evaluate our bandwidth and also look to kind of deduplicate efforts. So we see the LHIC, or the Local Health Improvement Coalition, as that means to continue the engagement with businesses.
Pam?
Yeah, I think times have changed, and many of the structures that were in place are not anymore. Some of the collaborative structures, as businesses resumed, have fallen a little bit by the wayside, but we continue to work very closely individually with the local health departments and continue to try and keep those relationships very open. We meet on a regular basis with both Orange County, California, and Orange County, Florida health departments, because we want to make sure that we know what they're working on and they know what we're working on. I think some of the industry groups, as a cruise industry has gotten back into sailing, and the conditional sail order with the CDC has been sunset. Those meetings that were happening on a regular cadence are no longer happening, but perhaps they're just not needed at this point in time.
Do you feel as though your work has made an impact on health inequities, either within your workforce and in the community? I'm going to ask you first, Pam.
How has our work helped with health inequities, Bob?
Right.
Is that what you said?
Correct. Yes, that is what I said.
Yeah. I think we've done a tremendous job of trying to reach across the diverse strata of cast members. Those are what we call our employees. Our employees, both at Walt Disney World and at Disneyland. I can talk specifically about those two sites. In Orlando, we have 80,000 employees, essentially. And we have a very active wellness program in place. What we have tried to do in that wellness program is really work with some lines of business that tend to have greater health issues. For instance, perhaps housekeeping or transportation, putting resources on the ground, whether it be nurses, health coaches, setting up incentive programs for participation, education programs, and making sure that we not only educate, but we educate in the language of the employees in those particular work locations, whether it be Spanish, Vietnamese, Haitian Creole. What we are continuing to do now is work with some of the local hospital systems and also with the health department on social determinants of health and looking at opportunities within those structures for Disney to work alongside those hospital systems in figuring out innovative ways to get our employees and their families into the care that they need within that social community. It's still it's still a journey. But I do think we are making strides in it.
And Letitia, what do you look for from business to help address health inequities in the community?
Yeah, I think, I really look for businesses to have an understanding of their workforce. I think there was a panelist mentioning even what we see with some of the wage gap and with some employees, obviously, who have to work frontline positions. And so we know that there are inequities. We know that those are the employees that are at highest risk. And so how are businesses really focusing their support on those employees? As a health department, part of our mission and our focus is always on addressing those inequities and healthcare and health outcome disparities, but making sure that businesses understand, again, in knowing their workforce, this particular workforce is highest risk because those are the front door servicemen, or this particular workforce is at highest risk. And that was often what we saw, the workforce who was least likely to get vaccinated. So again, partnering with us as a local health department to provide appropriate messaging and specific messaging to those highest risk groups that also were typically lowest in terms of income or receiving a livable wage.
I'd like to ask one more question of you, Pam, before we move to the audience. So you have personal goals as a clinician and as a health officer in a business. How have those goals been facilitated? How have they maybe been frustrated by the infrastructure of decision-making, the values of your company?
Yeah. Well, I think, coming out of the pandemic, there is a bigger focus by many businesses, including Disney, on the health and well-being of their workforce. And actually, a key focus right now is the emotional well-being, because the past 2 years have really taken a toll on many, many people. Everything from furloughs to layoffs to being rehired to sitting at home for 2 years. To coming back to a full-time job where you might be deconditioned, have all been things that, we haven't had to face before. So I think the business has been very supportive of really advocating for well-being, and we're setting up some infrastructure where our leaders are actually talking it. It's not just coming from the health department or the health and safety area for it. I think, frustratingly, it's always trying to get the right resources and enough resources to have the bandwidth to go across the population. But that's a reality in any line of business that you're in. And we continue to work to make sure that the funding that we do get is maximized for the health of our cast members.
Great, thanks. I see we have a question from the audience.
Great. Thank you for this panel. My name is Philip Alberti. I'm from the Association of American Medical Colleges. My question is for Pamela. So Disney World and Disneyland are in 2 different states. And in terms of COVID response, maybe 2 different planets and 2 different truths. So my question is, what was the kind of the Disney approach to navigating those 2 realities? Did Disney stick with the best evidence regardless of state expectations? Did you adhere just to the minimal kind of state expectations? What's the role of a business like Disney to promote population health regardless of local and state governments' philosophy or perspectives?
That's a great question. And actually, we even went as far as having a global response. We were lucky and unlucky. I don't know how you want to look at it, but we actually saw COVID emerging from both our Shanghai and Hong Kong parks. So we had some learnings from that experience, because those parks closed first before we even had to face into what was going on in California and Florida. But when I spoke about this center of excellence and centralized governance, that was really our infrastructure to make sure that we were applying the best science across all of our businesses, regardless of what the overlying regulations were. Now, where we saw differences emerge, of course, is when you're looking at what was going on in Shanghai or Hong Kong. They had a very different response strategy that, we had our core, but then we had other layers of regulations that we had to respond to. Likewise, between California and Florida. We reopened in Orlando back in July of 2020. The state reopened. We put all of our health and safety protocols in, including mandatory masks and adding hand washing stations and temperature checks and physical distancing. And we did, I think, a really good job of protecting both the safety and health of our guests and our cast members. Unfortunately, because California had other regulations, we did not get to reopen in California until April of 2021, which had a lot of other implications because our cast members were out of business, out of work for a longer period of time. And there we began to really try and work with the state health department, because it was really governed by the state at that point, not the county, to put forward the evidence that we had gained from our reopenings, not only in Florida, but in Shanghai, to help advocate for the businesses being able to reopen as quickly as possible. So we did try and use the best science and evidence that we had to advocate for our businesses, but we had to go along with what the states had in place.
Thanks. Thanks for your presentations. I wanted to ask, in regard to Maryland in particular, which has long-standing, successful all-payer system through insurance, and the very positive impact it's had on population health by way of its continuing to achieve the metrics necessary to maintain their waiver from CMS. I don't need to translate that, but I will, in the sense that obviously there's tremendous positive impact led by the insurance system and the health systems to achieve those goals. I'm wondering, specifically in the city of Baltimore, what you see with regard to employer or business contribution to that public policy through their own private means, if any.
Yeah, I think that's a great question. So to your point, and maybe I'll add a little bit for those that may be a little less familiar. Subsequently, hospitals have a global budget, and they're, I guess maybe an easy way to put it, they're incentivized to keep folks out of the hospital, right? And so they get to keep money if it's not utilized on hospitalizations, and they are subsequently required to have community benefit dollars. And as a result, as he mentioned, many of our hospitals have started population health programs, which isn't quite public health, though there are certainly many public health principles that can be applied to population health. And in Baltimore City in particular, we have 11 acute care hospitals, so more than any other jurisdiction in the state. I certainly think having the waiver encourage hospitals to partner with local health departments, because I think they recognize that we were going to have to work together to try to keep as many people out of the hospital as possible. And so I certainly think that presented itself the opportunity to move forward with a public-private partnership in the first place. I think as it relates to other businesses outside of the hospitals, I don't know how aware kind of the lay business community is about this waiver. Again, because I think we're in a healthcare town, and we have so many hospitals, we're very intimately familiar. And so what I will say is, in terms of the relationships with the hospitals, it greatly strengthened those partnerships. And I think it has really opened the door for even more opportunities to work with hospitals on population health strategies. We have, again, 11 acute care hospitals. I will say probably all of them approach population health a little bit differently. And so I think as a local health department, we have the opportunity, coming out of COVID to say, here is how we work together. And I name Hopkins and Maryland, but at some point, I think we work with every hospital in the city. And I was meeting with hospital CEOs at least monthly at different points throughout the pandemic as well. And so I do think there's an opportunity to educate the business community on certainly the advantages. But I think hospitals see that, and the pandemic, again, has really encouraged us all to figure out how do we do and approach population health together as a city. And going back to, I mentioned our local health improvement coalition, that involves all the hospitals along with those business owners and our academic institutions to really talk about what is our overall public health strategy and how does population health from our hospital partners kind of feed into and support that work.
Hi, Kara Walker, roundtable member and with Nemours. I'm really interested in hearing what you've seen as best practices emerging from COVID, both on the small employer side and large employer side. We heard about the intersection of disparities due to employment and economic factors. And it seems that there's an emergence of the private sector rising to the challenge of saying, we want to embrace health, we want to focus on well-being of our workforce, but we also recognize some of that are these economic factors. And I didn't know if you want to highlight some of those best practices that we learned from COVID and could carry forward as we're emerging stronger, really thinking about the role of benefits, of wage, of other factors that may really allow us to increase the health of populations.
Yeah, I think one thing I will say, and I'm going to use kind of our city as an example. And so our tourism bureau is called Visit Baltimore. And I think one of the things that we did early, so again, going back to those health business roundtables, was meeting with Visit Baltimore again to understand what were the unique challenges, again, especially facing our tourism industries. And we had a large convention coming to the city in February of, it was supposed to be 2021, it ended up being 2022, but months before, working with that group to understand what the safety needs were going to be, to understand how many people did they anticipate, and how do we, again, appropriately keep those folks safe, along with the employees that were going to be supporting this particular event. And so I think that's an example of a best practice of really engaging the local health departments early as you're thinking through many of those events. And I think that's a lot of what Pam mentioned that Disney did. In terms of, I would say, businesses thinking about the livable wage and workforce, I think it goes back to a lot of our messaging around what we knew the inequities were going into COVID. I think now everyone has heard the term social determinants of health, but making sure that employers understood that there was always going to be a portion of their workforce that was going to be more negatively impacted because of those social determinants of health. So I think trying to break it down and explain it to them in that way, right? And so that includes living wage, that includes how your employees get to work. That includes if they have childcare. That includes if they're, without a job for a period of time and can't, sit and wait for that call back.
I'd like to introduce one more topic that was someplace on the flyer about this program that we have not talked about, the crisis of climate change. And I'm curious, we've talked about some of the problems in businesses of health being really isolated and siloed from key decision making. I'm curious, Pam, about your engagement with your colleagues around environmental issues, specifically around preparing for, adapting to, and mitigating climate change, given it has been listed by every health leader in the world at this point as being the key public health crisis going forward. What is your role in Disney's decision-making regarding adaptation and mitigation?
Yeah, I would say I am not as close to it maybe as other CMOs are in other organizations. I do sit on our health and safety team at Disney, though our environmental and conservation team is actually a separate organization. But we definitely work together. I mean, Disney's got zero waste goals. We have committed to changing the type of fuel that is in our cruise ships. We've committed to environmental goals for 2023, 24, and 2030, which go to zero carbon emissions, I believe, by 2030. Although, don't quote me on that, but I think that's where we're going right now. We really have some high aspirational goals that we continue to support from a health and safety perspective in alignment with our conservation groups.
Great. And then I think I'm just going to take one more minute and ask you. So Baltimore, you're on the water. And I read a recent article that was a survey of hospitals on the Metro East Coast with respect to risk of flooding. And I think the figure was about 50% of hospitals in these 60 metro areas that were surveyed are at risk of flooding in the event of a Class 1 hurricane. And I think it was about 80% in a Class 2. What's happening in Baltimore with respect to protecting the health infrastructure?
Sure. So I will say that we have a very mighty Office of Public Health Preparedness and Response, and they work very closely, certainly with state emergency preparedness, but also with our local hospital partners to ensure that they have the support they need, along with the city's Office of Emergency Management. And so we know that if that were to happen, there's always a coordinated response. And so I can even think of times outside of the pandemic where the city has stood up its Emergency Operations Center in the event of weather-related emergencies. So our team, again, along with state teams, along with our Office of Emergency Management, supports our local hospital partners. The health department in particular serves as that liaison, typically between city government and our hospital or healthcare partners. I'm thinking of our long-term care facilities as well, to make sure that those residents are safe.
Great. Well, with that, I think we're at the end of this panel. Thank you so much, Pam Heimel and Letitia Zara.
Thank you.